What's up, guys? It's Josiah. I want to talk about diabetes, how we can reverse it. There's a lot of meds used for this and surgeries, and I want to talk about that, but also what you can do to reverse it more naturally instead of relying on meds. So what is it essentially? It's insulin resistance at the cell from too much blood sugar. So let's take a look at the cell here. So this is the cell wall. This is the nucleus. We have mitochondria that make our energy over here, Golgi apparatus for nuclear protein folding. Here's a receptor. This is an insulin receptor. And here is insulin locking onto that receptor, which opens this pore to allow our blood glucose into the cell for energy pathways into the mitochondria to make energy for the cell. So this is a problem when the cell is so full of sugar that these receptors start getting downgraded, meaning there's less of them on the cell. I know on this picture it shows one, but on the cell there's many receptors. And it becomes with less receptors, or the receptor no longer will accept the key, which is the insulin. We basically stop this process and our blood glucose goes up and up and up. And with this, we start damaging the arteries, we damage the kidneys, we can damage our brain, our heart, every system in the body is affected, including our eyes. So what do we do as medicine professionals? Well, the first thing we try to do is either increase the sensitivity of the receptor through a drug called metformin, or we try to increase insulin. So there's more of this insulin to bind to other receptors that are not shown on this picture, such as giving insulin, sulfonylureas, which cause the pancreas to dump more insulin, or the SGLT2, GLP-1, the new drugs like Trulicity, which cause the gut to basically release insulin. And the main thing that you can actually reverse this instead of having meds surgically is the bypass. So let's talk a little bit more about that and what the data is showing about what you can do about this without a bypass. So here we're showing a couple options here. We have the Roux-en-Y. So essentially, if you look at the stomach, it's been hacked. So here's the other piece of the stomach. And the jejunum, which is downstream part of the small intestine, has been attached essentially to that small piece of stomach that's left, and that continues down to the colon and out the rectum. So you can see the original part of the stomach here and the duodenum, which is the first 12 inches of the small intestine, has been left intact but reattached here on the jejunum. So when we eat, the food is going to follow this pathway down to the colon. Now, why is this reattached instead of just discarded? Well, our pancreas, which is not shown, actually dumps into the first part of the duodenum here. So we need this to help with digestion. And there's actually beta cells for insulin and other pancreatic enzymes that are required for life that we cannot get rid of. So that's why that's done. The other option is this adjustable band where the clinician, through, this is the skin here, a little device, can make this tighter, this band right here tighter or looser to restrict eating, essentially, restricting food coming down for energy. And so that's one way to approach this. The other way to approach this is to sleeve the stomach completely off, leaving a smaller piece of stomach, which will, when we eat, makes us feel fuller, or if we overeat, will cause nausea and vomiting. So that's another way to handle the eating problem. So all three of these are restricting food intake, essentially, because our bodies will reject if we eat too much. Now, the problem with some of these surgeries are well-known issues. Three in particular are, one's called dumping syndrome. So when you've had a Roux-en-Y or even a sleeve, if you eat too much simple carbs, you essentially will get sick. And the body you'll get major diarrhea or you get nausea and vomiting. You just simply get sick anytime you eat simple carbs like white bread or sugar or things like that, which actually has a benefit of keeping you away from those foods to help reverse diabetes. The other thing is if you get one of these procedures and you have diabetes, you're living at a 7% or higher, probably closer to 10% if you're untreated, blood hemoglobin A1C, and you are a raging diabetes person. And so your body's used to living at such a high level of blood sugar that once you start reversing that, your body feels hypoglycemic at a level that most people are going to be okay. And so you will get the signs of hypoglycemia, which is the adrenaline rush, the sweating, hopefully, and because you'll be able to get a little something in your system to reverse that hypoglycemia, the tremors, the shakes. The other thing I have cared for with patients in the ICU is any of these surgical procedures, especially the Roux-en-Y and the sleeve, can result in leaking at the incision line and reanastomosis line here, resulting in bowels basically spilling into your gastric area, into the bowel peritoneal area, causing sepsis, and it can, in some cases, cause death. So that's a huge deal. So that is the main risk with these. Now, when we run meds, we're running, basically the medications for this is either we're going to increase insulin, so all that's available to open those channels to the cell, or we're going to increase insulin sensitivity at the cell level in the liver, like in cases of metformin. But regardless, we're just giving more insulin. Whether it's a med or insulin directly is the most common treatment, but that doesn't reverse diabetes. You're just giving more insulin, which is going to allow you to eat as much as you want, and it's going to worsen slowly over time. You develop less sensitivity to it, and we have to just keep adding meds, and we don't end up treating the real problem. So I want to go over a couple studies that I was able to find about some things about gastric bypass, and a lot of the studies show that you can actually completely reverse diabetes 100% and get off meds with gastric bypass. And the reason is you're reversing the cause of the diabetes, which is food. So for most cases, unless you have an autoimmune condition. So gastric bypass is a very effective way to reverse diabetes. This is a retrospective cohort study performed, what's the date? I believe it's in 2013 on bypass patients. Now, this is not a high quality study because it's retrospective. They're looking at people and the results after the procedure, but they looked at over 4,000 adults who were either controlled or uncontrolled with type 2 diabetes who had gastric bypass. So they found almost 70% reversed their diabetes within 5 years after surgery. That's a huge thing. They're literally reversing diabetes with gastric bypass. Let's go to the next article here. Let's take another look. So this is March 2020. This is from JAMA. And comparing 5-year diabetes outcomes of sleeve gastrectomy versus gastric bypass. So they're only looking at the surgeries, trying to compare which surgery had better outcomes of the A1C, which is your sugar level stuck to red cells, up to 5 years after this. So if we look at these little graphs, which are nice. So here's your starting weight, whatever that was, and here's the time. So up to 5 years post surgery. This is Roux-en-Y and the sleeve. So here's the sleeve, here's the Roux-en-Y. Notice the amount of weight loss, 30% on the Roux-en-Y, a little less at 23-ish% on the sleeve, but that's within the first year. You're gonna lose 30% of your weight. That's crazy amazing, crazy amazing. Now let's go over here and look at the blood sugar, that A1C that we measure, how much sugar stuck to the red blood cells. So here's the starting. Now they're not gonna give the level, they're just making it a 0 because they could have started at 8%, which is like 3% higher than normal, which doesn't sound like a lot, but it's huge, huge. So here's the Roux-en-Y, here's the sleeve. First, oh, that's just months, not even a full year we've come here. And we're changing the A1C goal by a -1, a 1%, which is huge. To take it down 1%, I'd have to give insulin, and that doesn't solve the diabetes. So these people are making huge changes. And it was all these patients. So it's not, and many of these patients are completely reversing their diabetes, which is a huge deal. So now let's go. How do we change this without getting surgery and without medications? This is a metabolic issue. Type 2 diabetes is insulin resistance. All the studies show this. Calorie restriction, physical exercise equals loss of weight, improved insulin sensitivity, and mitochondrial function. So losing the fat is going to help with the receptor resistance. Decreasing our food intake and choosing healthier things is also going to reduce blood glucose, allowing the receptors to work better, and we can start getting off our meds. Now, the reason we do exercise is because the muscles become more sensitive to the blood sugar and allow the insulin to allow the blood sugar into the muscles to get it out of circulation. So you have to do some exercise. Now, we're not talking about going and sprinting like this person appears to, but we're talking about daily exercise, moving. You can start with walking. It just needs to be something. So let's take a look at this information that I got. Impact of physical exercise, calorie restriction in patients with type 2 diabetes, skeletal muscle insulin resistance, and mitochondrial dysfunction as ideal therapeutic targets. Now, they're actually looking at the muscles and other mitochondrial markers, biomarkers. But I wanted to just show this. So there is evidence that physical exercise and calorie restriction within 2 to 4 months improves insulin sensitivity. If we improve insulin sensitivity, we can start reducing our medications. We can start eating more properly, and we're going to have some changes. We're going to have huge changes. And if you notice this picture, these are whole foods. I'm not saying you just have to eat lettuce, carrots, and watermelon, but whole foods. They tend to not spike blood glucose. We can't do that with white breads, rices, candy bars, sugar. It's a well-known problem. Now, it also showed in the study that when we do these two things, we have a reduced production of reactive oxygen species. These are what cause cell injury and death. And that's the problem with the diabetes with the high sugar. It causes cell death because of the reactive oxygen species, essentially damaging cells and cell walls. So the other alternative to calorie restriction, actually monitoring how much you're eating, is intermittent fasting. You're essentially doing calorie restriction by reducing the meals that you eat and monitoring how much you eat and hopefully choosing whole foods, and you're gonna get a change. So we know you can reverse diabetes. How do we know this? When you get a gastric bypass, over 80% of people in the studies show complete reversal of diabetes. They come off the insulin, they come off the meds, they have complete reversal. So why? Because they're calorie restricted. They can't eat a lot, otherwise they vomit and from nausea, or they have diarrhea. So just the food is the issue, and that's what we need to do. Thank you very much.